Hi, I'm Kate Spellman. I work at AgeOptions, which is the area agency on aging for Suburban Cook County. And I work with our Thrive with Pride program, which seeks to provide peer support, education, and benefits to older LGBT adults in suburban Chicagoland. What you're about to watch is a video from our July plenary of this year featuring Director Paula Basta of the Illinois Department on Aging and our own President and CEO, Diane Slayzack. I'm going to try to put links to everything that these two women mention in the video description below. Please help me out by filling out the survey that's down there as well. We need to know who's viewing this and whether or not they're being helpful. As Director Basta says too, please remember that you are not alone in this time. We may be physically distanced, but there are many ways to reach out. You'll see phone numbers, email addresses, and websites below that can help you connect yourself or other folks with resources in your community. Don't hesitate to reach out on behalf of yourself or someone else who may need the extra help and support. This COVID-19 pandemic is difficult for all of us. Thanks for watching, and again, fill out my survey. Thank you. I am joined today in conversation with two of the leading lights, I will say, of aging services, certainly in suburban Cook County, and definitely in Illinois as a whole. Diane Slayzack is the CEO and President of AgeOptions. Diane, this is public information. I pulled your bio off of our website, so I can say that you joined AgeOptions in 1976, becoming President and CEO in 2018. Diane has worked tirelessly on behalf of older Illinois adults for most of her career, and has worked to design and establish several new programs in suburban Cook County, including the Healthcare Choices program that helps older people understand and make informed choices about their healthcare coverage, and also the Family Caregiver programs, which works with 13 community agencies to provide caregiver specialists. She has a host of other accomplishments, as well as a variety of civic and professional engagements. But from the interest of time, Diane, I will let you add those yourself as you see fit. We are also joined by the Director of the Illinois Department on Aging, Paula Basta. Paula was appointed as Director of the Department in March of 2019, becoming the 13th Director and the 7th woman to lead the agency. She too has an extensive career of dedication to improving the lives of senior citizens in Illinois and brings a vast amount of knowledge and experience in senior services, policy, and social justice to lead the agency. Paula is also an active community member who dedicates her free time to many boards. Among them, I'm not going to read all of them, but among them, the Cook County State's Attorney LGBT Advisory Council and Test Positive Aware Network. She is also a current board member at the Center for Law and Social Work, Chicago Network on Lesbian, Gay, Bisexual, and Transgender Aging, Windy City Performing Arts, the American Society on Aging, and chair of the LGBT Aging Issues Network. She also serves as an adjunct professor at the Loyola University of Chicago. And for all of this and much more, which again I'm glossing over, was inducted into the Chicago LGBT Hall of Fame in 2009 and named to the Illinois Women's Institute for Leadership class of 2010. Quite impressive, and I am very much skimming through that. So welcome to both of you. Thank you so much for coming to be with me. I'm going to ask you both to share just a little bit about the agency and department that you work with, a little bit about how they're reacting to the COVID-19 pandemic, and in what is hopefully a much larger journey, how you're working to become more inclusive of LGBT older adults in aging services. And then last month we asked folks to tell us questions that they'd like to hear from you on. Most of them were about housing, so we'll speak a little bit about that as well. I'm also going to try to keep us to 20 minutes or so. We're recording this for YouTube, and that's probably about as long as anybody's attention span lasts online. So that's quite the broad range of questions, but we'll hopefully have time for a little audience Q&A after this as well. So welcome so much.
Thanks.
Thanks. Director Basta, let's start with you. Do you want to say just a few words to explain what IDOA is, how it works under normal times, and then maybe if there's anything in particular you want to highlight during the COVID pandemic era?
Now the new normal, which is really what we see here before us in Zoom. So the Illinois Department on Aging was created in 1973, and it was created through the legislature. And in the state of Illinois, there are 22 state agencies in Illinois, and the Illinois Department on Aging is one of them. We are in charge of providing services to older adults. We estimate right now that we basically are serving, well, there are 2.7 million older adults in the state of Illinois currently. So by the way, I want to give a shout out, and I know maybe Diane will too. If you have not done your census, please do your census, because this is how we can make sure to track that we are out there, and that helps us with our funding stream. So I want to make sure people, that's also how we think that, given what the census will show us, hopefully we'll get better numbers as to how many elder adults there are out there in the state, and that's one of the ways we'll do that, through the census. The Department on Aging strives for efficient and effective access to services. We basically, have a mission to make sure that people stay in their homes for as long as possible. And to that end, we have a whole series of programs. We are a small but mighty sort of agency. We only have 155 employees. For a state agency, that's pretty small, but we have a big budget. We have a $1.3 billion budget. $1 billion of that is through our community care program. And I want to also say that the reason I'm in Springfield is about 130 of our staff is based in Springfield. We only have about 20 people up in Chicago. So let me just go a little bit through the snapshot of how we get our funding, but also we also are making sure that we have our other what we'd like to call our aging network, and that's including 13 area agencies on aging. Diane, of course, is one of the area agencies on aging that we have. And we have 55 care coordination units, which are our care coordination units, or CCUs. Basically, that is the program that oversees our community care program. We have about 110,000 seniors in our community care program. So that's again, people that are staying at home, making sure that they're getting the services they need to sustain themselves in their own homes. I know Amy Lulich is on, and if she wouldn't mind, I'd like, if we're in the chat, if Amy, can you pull up our website? I'd really like to make sure to highlight that the Department on Aging has a very comprehensive, great website for you all to go on. I think it's a great way then to kind of take a look at the state. Thank you, Amy, you're the best. A great way for you to see in all the areas of the state, maybe who your AAA, your area agency on aging is, because that's really who is our boots on the ground providing services to seniors. And again, we want to make sure that you know that we are here to help you in all different ways as possible. We expect that in another 10 years, in 2030, the aging population will go from 2.7 to probably about 3.2 million. We're not sure exactly, but we'll see how the census goes. But again, we have our work cut out for us because we do the community care program, adult protective services, which is elder abuse, and also disabled folks 18 to 59. Long-term care ombudsman program. These are folks who are advocates in each of the nursing homes throughout the state of Illinois. We have home care ombudsman program. We also do the benefit access program. We have also all the older American services programs that fund information and referral, outreach, nutrition, congregate dining, senior centers, employment services, transportation, along with all kinds of other community supports. We also have the senior health insurance program, which is called SHIP. Those of you who also have issues around Medicare, Medicaid, any kind of health insurance issues, we have volunteers who are on the ground that help you go through those programs. So I want to give a shout out to the SHIP volunteers. They're doing great work. And I think that I'm going to stop there and let Diane speak next.
Paula, that was a dizzying array of programs. I'm kind of glad to see that you're reading something.
I am, yes.
Remembering. Would you like to just say a quick word? I know that IDOA has worked really hard to pivot and change programs in light of current worldwide circumstances. Anything you want to highlight from that Herculean effort?
Yeah, I mean, I think what we're finding right now is because of COVID, we had to close 400 senior centers and over 75 adult day centers. And so what was happening is that then we had to shift from providing congregate dining sites to home delivered meals. And so to that end, we are now delivering between 45 and 47,000 home delivered meals a day throughout the state of Illinois to older adults. So it's been quite a task. And I'm sure Diane can talk more about it. It's been such a heavy lift, but our aging network has done a remarkable job in providing services at the most unprecedented times. And I just want to give them all a shout out as to how this has been unfolding, right? Of how the services are that we need to make sure we're giving to people. So I'm just going to kind of give that little snapshot of just one of the many, many ways that COVID has really changed our lives.
Yeah. Thank you, Director Basta. Diane, would you share a couple words for us about what AgeOptions is and what we do both during normal times and in the new normal, as Paula called it?
Well, thank you. And thanks, Paula, so much. It's always a pleasure. This is the second Zoom we've shared together in 2 weeks,
Yeah,
I think. So we kind of
I see you more on Zoom now. Yeah.
tag team, but I miss seeing you in person. So AgeOptions is one of the 13 area agencies on aging in Illinois. As Director Basta mentioned, there is an area agency on aging that serves every single locality across the nation. So no matter where you are across the country, if you're in Florida or Maine or wherever under the Older Americans Act, there is an organization designated as an area agency on aging and have some similar services under each of their umbrellas in each of the locations. So AgeOptions in particular has looked at the range of services that we have a pleasure to provide under the Older Americans Act, ranging from congregate dining, home delivered meals, chore services, transportation services, on it goes, as well as adult protective services and the whole list that Director Basta mentioned earlier. In addition to our program, which used to be called Make Medicare Work, I need to update that biography considerably. I think it's been since the 80s that I updated it, embarrassingly. But anyway, the Make Medicare Work program is now called Advisory, and it is a program that's been funded by Retirement Research Foundation and through fee-for-service programs for many years now, and provides professionals training on Medicare and Medicaid issues in depth. I love to say that the director of that program used to like to wait to get her Vogue magazine in the fall, and now she waits to get the Medicare guide instead. So, that Medicare manual that arrives at the beginning of every year. So in addition to that, we have long hoped for a program that would serve LGBT adults. Our vision at AgeOptions is people thrive as they age. We like a very person-centered approach to looking at programs. And that means that one size doesn't fit everything for everybody. Black Americans might want one kind of program. LGBTQ older adults need a different kind of programming, and we really strive to develop programs that are tailored to the needs of those individuals. So we were very pleased to bring Kate on and to be funded by Community Memorial Foundation and now by the Chicago Community Trust. And I'm so pleased to bring all of the congregations and groups on that are working with us on this terrific initiative. And I just love that Lake Street Church is on, because I have a long connection with Lake Street Church. So that's kind of a rundown. I'll just briefly, the COVID pandemic changed everything. I believe it was March 13th that we shut everything down overnight and began to provide grab and go meals at all of our congregate dining sites. The 6,183 people that were receiving home delivered meals every day about tripled to the current rate that we have. We had about 30 new older adults asking for more meals every day, even after it calmed down. And we started finding many venues for delivering those meals, including fresh food in top box form with produce and protein to deliver to people who could still cook, all the way to mom's meals, which are special diet meals delivered to the door of older adults. We really relied on all of our partners to help make all of this happen during this enormous turnaround. The Cook County Department of Public Health, the Cook County Sheriff's Office, the Cook County State's Attorney's Office, amazing things, Little Brothers of the Poor. So many different partners came together for us when we were really in need. So partnerships that we invested in across many years kind of came to fruition, and everybody around us kind of came in to pitch in. So we had Sheriff's Police delivering meals and training coming out of Little Brothers and all kinds of help wherever we needed it. So thank you to all those people that helped us. So sorry to be long-winded. It's hard to smash that into a few sentences.
Yeah, both of these agencies were doing tremendous work before the pandemic and have had to shift tremendously into the pandemic. But I want to move on from there. And Diane spoke a little bit about what AgeOptions is doing to work on becoming more inclusive and more responsive to the needs of older LGBT adults. And Director Basta, I'm wondering if you'd like to share what IDOA has been working on, because I know that this is an issue that you're both personally and professionally invested in.
Sure. So we know that there's many LGBT older adults living in Illinois, and we also are aware of discrimination that can happen. We are working on trying to make sure, though, that we get more data so that we can sort of beef up how it is that we go to our legislators to understand some of the needs, both on a local level, but on a federal level, so that we make sure that they realize that we are growing older just like everybody else, but we have certain special needs and we need to have them acknowledged and supported. We want to make sure, though, as a state agency, we have taken on, and as all the 13 area agencies on aging, social isolation as a huge issue. And in that way, we have been able to fund our AAAs and doing social isolation, trying to work on social isolation as a factor in how older adults are aging. And this in pandemic times is even a more increasing issue. And so then put on top of that the LGBT piece, we want to make sure that we're trying to do as much outreach as possible to make sure that people know about all the programs and services that are available to them. It's very, very important to us that we make sure that we have culturally competent services out there. And so to that end, what the IDOA did as a state agency was this past January in 2020, we were able to host with SAGE a webinar for all of our 13 area agencies of aging, as well as our 55 care coordination units, a major webinar that explains and went into the LGBT older adult experience. And so we actually then became, I guess it's called a platinum sponsor of SAGE training, where it's on our website. We're very proud. I think, Diane, though, you guys might be a gold standard by now. I think AgeOptions has been doing this a lot longer, but we as a state agency, it was a very important mandate. I know the governor is very, very supportive of LGBT issues as well as LGBT aging issues. So it was important for IDOA to become a SAGE credentialed provider. It's a badge of honor. It's something that we want to make sure that our consumers know that we have done the training, and we are, hopefully you are feeling the effects of that training as you call us, and make sure that we are constantly noticing and being aware of how the aging population is diverse. And that's a good thing. We want to make sure we have a welcoming and safe space for LGBT older adults, and we want to make sure that our providers are doing that as well. So it was very important to us that we did that. The other thing that happened last year was in, I believe it was March of 2019, just before I had actually been appointed as director, the governor had signed Senate Bill 1319, and it basically talked about discrimination in assisted living facilities. The bill added terms sexual orientation, gender identity, gender expression, and HIV status to the definition of the greatest social need. because in the legislation, you'll have the greatest social need means different things. But we wanted to make sure that LGBT was included. And so that makes sure that that we're looking to have a highlighted piece of how that our population is being noticed. And that basically, if there's any discrimination going on, that you have ways in which you can be covered. So I'm going to stop there and kind of give you those couple of snippets, but happy to answer questions.
Thanks, Paula. We'll also make sure when I upload this video to YouTube to add a link to Sage Care. Sage is Service and Advocacy for GLBT Elders. They are based out of New York, but do national training and have some affiliates in the Chicago region as well.
And we have it on our website as well, so that's great.
And they have a directory where you can look up providers by the level of training that they may have had with LGBT older adults.
Yeah, it's great. It's wonderful.
Yeah. Diane, would you just like to add a couple words about what we've been doing at AgeOptions?
So we are also platinum certified, and we really applaud what Paula has done in terms of making this training available to all of our providers. That is absolutely the direction that we want to go in, is to have even, a continued focus on LGBT friendly services and making sure that our providers that AgeOptions funds through the Older Americans Act and our special funds all have a strong foundation in understanding what it takes to be person-centered and to make sure that the LGBTQ population is served in a culturally appropriate way. And so, we have a goal of reaching out and increasing the number of cafes through grants that is going to be continuing to work on. And, we want to see these explode throughout the county as needed, and then to work very closely with our existing service providers hand in hand to make sure that that whole population receives services as needed, and that nobody needs to go back in the closet either at home or when they go into a facility, that that they're treated with respect and appropriately, and that all of the wealth that they have to offer in terms of life experience is taken advantage of by our community. So we have done internal training at our senior leadership level in depth, and we'll be continuing to do periodic training of our staff. I know Kate is going to help support us. We're just so pleased to have her on staff with us.
Thanks, Diane. I want to move on. So when we asked folks on our last call what they would ask for you two who really have kind of the 30,000 foot view of aging, a lot of people had concerns or questions about housing, both where we sort of see the trends going. Will there be more LGBT specific housing or retirement facilities in years to come? How can we prevent abuse and harassment as people go into long-term care? And maybe even before that, how we can continue to support people to age in place. For a lot of folks who have concerns about either going back into the closet or harassment or abuse, the preference is to stay at home, right?
Right.
Paula, any thoughts, anything you see developing statewide or nationwide that people would want to know about?
Right. What I'd like to highlight, though, is the state agency that handles housing, which is IDA, the Illinois Housing Development Authority. And in particular, I wanted to highlight that they're coordinating emergency rental assistance and emergency mortgage assistance programs, specifically targeted during COVID-19. I want to talk about that a little bit, if that's okay. It's not necessarily through the Department of Aging, but it's through IDA. And they have an emergency rental assistance where they are awarding up to $5,000 to applicants. Applications will be starting August 10th. So this is a good time to talk about this. And so also for mortgage assistance, they are awarding up to $15,000 per applicant. Again, I'm going to give you their website, and if Amy, you can do this as well, put it on in the chat, www.ihda.org, or call 312-836-5200 for those programs. As far as what's being built, I think that, I obviously would love to see more LGBT housing. I think it's really important. Again, the Department on Aging doesn't build, we just provide the services to support the people that live in the buildings. And so that's kind of why, you know, I don't have much to say as to how much more will be built. I would think that obviously Mayor Lightfoot in Chicago would be looking to do more, but I don't know of much happening, being built at this moment. Of course, we have Town Hall, which is a great model, but we definitely know we need more housing. And housing is just a huge issue just in general, and more affordable housing. So I'm not sure you know, I don't know, Diane, if you want to talk more on the local level.
Well, I will, Paula, before you left the Cook County, not Cook County, Chicago Housing Authority, was there any special emphasis on providing any kind of specialized housing for LGBT populations, or?
Not specific to LGBT specific. I mean, obviously, I think that they are very aware of LGBT programming and housing and people living in CHA buildings that are LGBT. And I think they're working hard to try and make themselves inclusive and supportive. But I don't know what their plans are. I wish I could tell you, but okay. I don't. So
no, I just was
curious. Good question. It's a good question.
Anything? Yeah, I have not. So housing is an area that across the board, almost every single day, outnumbers any other information and assistance request that comes into our office. And unfortunately, our budget, we could put our entire budget into building housing and we wouldn't have, it would be a drop in Lake Michigan. It just wouldn't begin to touch the need that we have in terms of housing. So I just want to echo what Paula said and just underline it. And, you know, please, I'm so pleased that you're calling this to our attention again. We have made this a countywide issue at AgeOptions a number of times. I wish I could report great success to you. We've been working with the Metropolitan Mayors Association, with the Cook County Housing Authority, and with other bodies that are responsible for actually brick and mortar buildings. And at times, I mean, at times we've thought about, is there any way that we could, you know, put together the cash to get involved in actually building housing, and it hasn't happened. I mean, I've done a lot of crazy out there things since I became director, but I'm not sure we're ready to try and figure out how to actually build housing. I wish we could, but you're spurring me on and, you know, making me think the next time we meet with our partners at any of those housing organizations, we need to focus on this. Mm-hmm. You know, is all I could say to you right now. I wish I could promise more. I just know across the board for people of all ages, this has been a high level need. Right now, we were fortunate. We just received a second, the third bucket of Illinois COVID relief funds, and we will be using some of those funds to help people with mortgage payments and rental payments, and that will be in some cases kind of piling on. The Department on Aging offers emergency services. It's ESS, right? Yeah, emergency services funding through the CCP program. And sometimes the needs for a mortgage payment or a rental payment are so high that we're able to use some of the COVID relief funds in concert with the Department on Aging ESS funds, which is a blessing if people just need to get through a month or something like that. And CDL has been working with us. And Elizabeth, I know you're on with us on a housing preservation program. So under the CARES Act funding that we received to help combat the difficulties that people are having during the pandemic, we are working closely with CDL to make sure that people get help. And we really like to help them before eviction, of course, begins to take place. So even though there's been some extensions right now on some requirements for mortgage payments, and people have been like allowing longer periods of time to pay rent, if you know of somebody that's worried, we want to start to work on that before the eviction proceedings actually get into high gear. So please reach out to us in that way.
Yep, absolutely.
So we're officially over time, but
I noticed that. I may have to jump off. I apologize.
Okay. Any closing remarks, Paula, before we?
I want to make sure that you guys have the senior helpline number, again, statewide. So anywhere, whoever's on this call, wherever you live, If you want a senior helpline number for all aging services throughout the state, 1-800-252-8966. Thank you, Amy Lulich. She's up there. She's got it posted. She's the best. And then the other thing I just also want to be aware, make people aware of, is our 24-hour APS helpline hotline. Unfortunately, all elder abuse, adult protective services, it does happen. We want to make sure people know that if they feel as though they know of or they themselves are a victim of exploitation, financial exploitation, emotional abuse, any kind of abuse, that they could call 866-800-1409. Again, that's 24-hour call, 866-800-1409, for making sure that they have those appropriate numbers. Thank you, Amy Lulich. You did put that on. I appreciate that. And that we just want to know, make sure people know that they are not alone. Really, we are here to help. We have such great partners in our AAAs, our area agencies like AgeOptions, and the wonderful work that AgeOptions is doing is just a beacon of hope for all of us. So as much as we can support each other, we do that, and hopefully we will do that, pandemic or no pandemic. So all of you, please stay safe out there. Please stay safe. Wear a mask. Wash your hands. Do I sound like Dr. Ngazi? Ezike? But know that we care deeply about you, and especially my LGBT peeps. Please love you guys. Thank you for all your support. I feel it every day, and I'm very, very appreciative. Always grateful. Thank you.
So much.
Thank you, Paula. Thank you.
Thank you.
Thanks so much for watching. I hope you'll join us for our next plenary, which will be Tuesday, August 25th at 11 a.m. One of my colleagues will be here to discuss the Boost Your Budget program, which can help you make the most of all the benefits and services you may be eligible for. I've only been in aging for a few months, but I can tell you, usually there are more resources available than people make use of, or that certain populations take advantage of. There are many ways that you may be able to save money or make your dollars stretch a little bit further. So be sure to join us on August 25th or watch this page for our next video upload. Thank you. Fill out the survey.